There have been a lot of changes lately, like here in Raleigh. There's caution tape up around a playground to promote social distancing practices. But some of these changes might not be as apparent to all of us, like the way we treat each other. Viruses don't discriminate against people based on race or ethnicity, but stigma in the media surrounding the coronavirus exists regardless.
The Wuhan coronavirus has now surpassed the 2003 SARS outbreak.
The first U.S. case of Chinese coronavirus was confirmed at one of her hospitals.
Inside that building is the world's first lab-grown copy of the Wuhan coronavirus outside mainland China.
Even in the highest held office in the country, when asked why he calls it the Chinese virus, President Trump says,
"It's not racist at all, no, not at all. It comes from China. That's why. Comes from China. I want to be accurate."
But when it comes down to accuracies, one Chinese researcher here at UNC working on a cure for the virus says he won't call it anything other than SARS-2 or coronavirus because
discrimination is a barrier to cure. Discrimination is a barrier to prevention. Discrimination is a barrier to protect the vulnerable.
The usage of this term isn't just receiving backlash here in the United States, but also overseas, where the outbreak began.
The World Health Organization and the international community are clearly opposed to stigmatization and linking the virus to specific countries and regions.
But for Brendan Chang, a Chinese-American student at Duke University, the Chinese government doesn't speak for everyone.
Personally, I don't feel as though the name inherently is harmful. I mean, like the Spanish flu, no one really looks back at that as like a travesty, and it didn't even originate in Spain. It was just first discovered there. COVID-19 actually came from China, as far as we know. So it doesn't not make sense to be called the Chinese virus.
While the president has gone back on his usage of the term for now,
it's very important that we totally protect our Asian American community in the United States and all around the world. They're amazing people, and the spreading of the virus is not their fault in any way, shape, or form.
It appears the rhetoric has already done some damage.
Discrimination is as bad as the virus itself. It's a disease in human mind.
Jilly Kuhn, Chapel Hill, North Carolina.